I will make my okay, I will make my remarks brief, but I'm honored to have been asked to introduce the topic and to introduce Charles. Uh, it was about a year ago when we first started hearing about the COVID outbreak. Scientists and leaders in some areas of the world had begun to see it in the couple of months before, but it really became evident that this had the potential to become something that was quite serious and widespread, and indeed it has. So we have spent a year like no other, and I was in a meeting earlier where we were getting ready to start the substance of the meeting, and we were engaged in some chat about things, and COVID came up, as it invariably does, because it presents a backdrop to all of our lives right now, and there are numerous challenges. I'm reading a book by Farhid Zakaria called 10 Lessons for a Post-Pandemic World. And it's interesting because I think we're all looking forward to a post-pandemic world. And we hoped we would be there by now. I think there are some amazingly positive things. The fact that vaccines were developed that were highly effective were developed in a very miraculous almost period of time is a wonderful sign. Our getting those shots in the arms is the big challenge right now, and that has to move ahead. But I think Yvonne was right. It's something that we get tired of hearing about, but we can't not hear about it. I watched a documentary on the Spanish flu in 1918, and the patterns are remarkably similar, and we have some benefits that they didn't have then. We can work remotely; they had to go on with life. So this is a critical point as far as I understand in my reading and observing this. We are at a very, very critical point in getting past this. And so I think this is a most timely session, and I'm really honored to be able to introduce a person who is an expert in the area of public health and making leading the charge to understand and combat the pandemic. I saw I think it was the LA County health director said the other day, he said, you have to assume that when you go anywhere and you engage with anyone, that COVID is present. And so I think it's something that we need to stay up on, continue to battle against, continue to be careful. And so I'm really pleased to introduce our presenter, Dr. Charles Holmes, is a PhD and an MS in public health. And Charles is an associate professor at UAGC. He's been has spent 20 years of his career in public health. He's for 10 years been an instructor at the university level. He's the program chair of our Masters of Public Health program in the Department of Health Sciences and in the College of Arts and Sciences. And I've had the opportunity several times to speak with Charles, and we've corresponded some, and he's the perfect person to help bring us up to date on this. And so, Charles, thank you for being willing to do this, and I know that we'll all benefit from what you have to tell us. I'll turn it over to you.
Thank you, President Swinson, and thank you everyone for joining us today. I'll go ahead and share my screen. So as President Swinson mentioned, I'm Charles Holmes. I'm the presenter for today. I've had the pleasure of working for the University of Arizona Global Campus since 2013, and as the lead faculty of the Master of Public Health program and the chair of the Institutional Review Board, I'm able to see a broad variety of research on the topic. Prior to working at UAGC, I worked at the University of Illinois and with public health offices in Douglas and Coles County, Illinois. And here in Colorado, I regularly consult with the Tri-County Health Department, Denver Public Health Department, and the Colorado Department of Public Health. As a bit of a disclaimer, due to the developing nature of this pandemic, the information we continue to learn about the virus, the information I'm presenting and some of the recommendations are likely to change. As an additional note, as you hear the statistics, many of which are devastating to hear, know that you have the power as an individual to make a significant impact by following the CDC guidelines related to wearing masks and social distancing. And to start off on a bit of a light note, the image in front of you, that is a picture of the coronavirus. And Yvonne and I met in the room just prior, and she said, "Gosh, I'm tired of seeing that image." I said, "Yeah, no, it's like a virus. It's just everywhere." So it'll be a happy day when we no longer have to look at images of viruses. One of the things that spurred my motivation to do the original colloquium in April was the amount of misinformation. For this one, the motivation is the vaccines, but the misinformation remains prevalent. So it's sad to say that many of the popular sources still contain inaccurate information. And regardless of politics, the comments made by the president and many of the teams still contain a lot of inaccurate information. And some of that information and advice can be harmful. So the best source of information that we have still remains to be the CDC, and the two experts at the top related to this pandemic are Dr. Anthony Fauci and Dr. Deborah Birx. So if you choose to go look at your own research, which I encourage you all to do, this would be the best source of information. One of the most common questions or statements I guess I hear from those that don't believe the virus is of concern is that if the media tracked the flu virus with the same intensity that we do COVID-19, it would show the same information. I can tell you definitively that is absolutely not the case. In the United States, pneumonia and flu combined in a bad week average about 2,000 deaths per week. With COVID, we're seeing instances of 3,000 to 4,000 deaths a day or 20,000 deaths in a week. So if someone wanted an accurate comparison, the tracking coronavirus is like tracking the common cold with a death rate that's much higher than the flu and much higher than the flu and pneumonia even combined. The coronavirus is not more deadly than the flu and not more deadly than pneumonia, but because of the sheer prevalence of it, it is killing that many more people. So if you hear anyone say that, if we tracked these things, it would be the same, I can tell you definitively it would not. Just as a brief refresher, there are 7 types of coronavirus, so COVID-19 is not anything new. There's 3 that are considered severe. The other 4 give you symptoms that are in line with common cold. And these are all variants of the cold virus in one way or another. So that can be seen as very good or very bad. From a public health perspective, we see it as a positive in the sense that because it's based on the cold virus, it is very easily cleaned and destroyed with common household products that almost everyone has. And it also can be easily prevented by following, basic procedures. It's very bad in the sense that it is very highly infectious. And we'll talk about some of the new variants and things like that are out. But those are the 2 things from public health perspective. But that is absolutely a silver lining, is that it's easily killed. We shudder to think how bad the infection and death rate would be if it were not easily cleaned with just basic household cleaners. With COVID-19 being a variant of the cold virus and generating things like cold-like symptoms, COVID-19 is lethal primarily because of the impact it has on the host lungs. It essentially prevents the mechanism designed to remove foreign bodies and excess mucus from the lungs and allowing it to form itself. This lack of removal impedes the oxygen and CO2 exchange and makes breathing far more difficult and can lead to acute respiratory distress syndrome. So if you think of like when, like that when you clean your throat, that's your lungs compressing air, pushing up the mucus and other things that may be in your lungs, hopefully getting them up to your throat just below your mouth level, allowing you to swallow it and allowing whatever it is that they've expelled to get destroyed in your stomach and stomach acid. COVID-19 prevents that mechanism from happening. So in the advanced stages, COVID also is having severe impacts on liver function and kidney function. So when combined, the individuals who are passing away, those who do not pass due to, for lack of a better term, suffocation, are passing away due to organ system failure. So I have some images from a CT to show you kind of how COVID impacts the lungs. The individual on the left has acute respiratory distress syndrome due to advanced stage COVID. The person on the right has healthy lungs. So you can see on the left, the individual has what radiologists would call that ground glass opacity. And you can see how difficult it would be for the lungs of someone with advanced stage COVID to actually be able to breathe. This person on the left, without question, is probably on supplemental oxygen, and if not, they're likely on a full ventilator. They just would not have the capacity to make the carbon dioxide and oxygen exchange needed, where the healthy individual could do it without issue. So while the desire is for no one to ever become infected with COVID, if someone said to me today, Charles, today you have to become infected with COVID, do you want to be asymptomatic or symptomatic? 100 times out of 100, I'm going to choose asymptomatic. That said, asymptomatic is not without its own perils. In almost half of cases that have been tested, the virus still is causing harm within the body of the host, and those can still be easily transmitted. So that's that asymptomatic that you hear so often, where individuals are symptom-free and then they walk around even though they have the virus, and they're able to transmit the virus to family and friends without wearing a mask or socially distancing. Since the virus focuses heavily on the lungs, those individuals that are asymptomatic have just an increased lung capacity. Typically they're younger. And if we go back to that previous image, the ground glass, or that opaque area there that prevents the lungs, it's on the lower levels. So the individual is able to breathe without having significant difficulty or being fully aware that it's an advanced stage disease. For those who have become infected and were symptomatic but have recovered, the story is somewhat similar, but often more severe, while still being studied very much. I mean, we're not even in a full year of this pandemic, even though it feels like a lifetime for many of us. The individuals who have recovered but had symptoms, they still have sporadic fevers, delays in thoughts. We have individuals that they were infected in March and April, and they're still seeing fever spikes of over 100, which indicates that the body's going into like a hyperimmunity where it's fighting itself because it still believes the virus is there and it's attacking it. Unfortunately, the virus or the immune system actually will start attacking itself and healthy cells. Individuals will still suffer from fatigue, persistent cough, delayed breathing, or difficulty breathing, and easily out of breath. Fortunately for us, the lungs very quickly can repair themselves, but you have to be free from the virus. And that's what we're working on. Public health is trying to figure out first how we can stop people from becoming infected with the virus, and then physicians are working to try and figure out how we can best treat individuals so that when they do fully recover, that recovery can happen in a more rapid pace. Epidemiology is the public health term for kind of tracking the spread. I myself am trained as a public health educator, but epidemiology is how we collect all information in public health. So my goal as a health educator is to take the kind of the complex information of epidemiology and distill it down into useful information that can be kind of distilled to everyone. So what we've seen with epidemiology is that significant increases of infections have been seen throughout the world. Everyone's aware of that. What's not fully aware is the reason for this spread still primarily is due to mixed messaging and delayed responses. The United States has seen the greatest toll from COVID-19 of any country in the world. The number of infections currently in the United States exceeds 23 million. And to date, we've lost over 385,000 Americans, and 3,000 new deaths are happening a day. I saw just this morning that we passed a milestone. I think we had 4,000 pass away yesterday from COVID. So it is a very, very serious virus. We're on pace in the US to have more casualties from COVID in less than 1 year than occurred in all of the whole of World War II. So in World War II, we had from US casualties, we had about 405,000. And we are projected right now, if everything stays the same, we'll have 420,000 COVID deaths by Valentine's Day. The daily rate, the 3,000 to 4,000, is higher than what we had on September 11th in those terrorist attacks. So while these numbers can make you feel numb, I implore people whenever they talk about pandemic fatigue, which I suffer from and we'll talk about, to think back to milestone moments. And for me, September 11th was a huge milestone moment. To think that that is happening every day or at a greater level, that gives me the strength and the vigilance I need to protect myself and my family. And hopefully something like that, some mnemonic, will help you. For an additional reference, the next closest country in terms of infections with 10.5 million is India. For those of you familiar, India is a very densely populated country. They have 1.37 billion people compared to the 311 million we have here in the US. So essentially they have 4 times our population, but just half the infection cases. That shows the failures that we've made as a country in terms of controlling this virus. And again, while pandemic fatigue is absolutely real, I would love to be before you talking about any other public health topic than this. We absolutely must remain vigilant because, as Dr. Swenson mentioned, we are at a tipping point. Our virus load and the new variants that are out that we're going to talk about are so prevalent and so highly infectious that if we back off just even a little bit and relax like we did over the holidays, we're going to get into a situation where the healthcare systems throughout the country are going to be overwhelmed, not just in a few select areas. These 2 graphs are helpful in that many speak of pandemic waves. If you've done any research on the 1918 pandemic, they talk about the 3 waves that they went through. And a lot of that was due to traveling for World War I. And while waves have occurred, you can see from the 2 graphs, especially on the lower one, the world infection rate has remained pretty constant and pretty constantly rising. And in the US, because we had such poor testing at the beginning and such a poor response, I'm not comfortable calling this a 3rd wave. It seems premature. This is more in line with like a 2nd wave. And while the holidays absolutely have had a significant impact on this rise that we're seeing since November, something additional is at work, and that's the variants that we're going to talk about in a bit. This is a map from April 1st, 2020. With the concept of exponential growth in mind, there's not a lot of, if you don't work in public health or with mathematics, exponential growth is not something that's easily understood. So I like to use visuals to try and convey those. So this is from April 1st, 2020. New York City was the epicenter. And the rest of the country was starting to see kind of sporadic pops of infection. Currently, the the world is seeing about 500,000 new cases, and in the United States, we see about 200,000. In April of 2020, it was predicted by the CDC that without appropriate national measures in place, so the entire country following these rules, we would see the largest surges in Southern California, Chicago, South Florida, and what's called the Metropolitan Triangle of Texas, Dallas, San Antonio, Houston. It's a very large geographical area, but very densely populated. And the next graph does well to highlight that those predictions absolutely came true. So this graph is from today. However, the scale has been significantly adjusted to account for the rise in numbers. So on the previous graph, the largest site of infection was New York City with almost 30,000 cases. So if I briefly go back to that, you'll see this huge circle. It's encompassing just a massive portion of the Northeast because it was trying to emphasize how many numbers are there. Today, we don't have that luxury. In Los Angeles County alone, there are 946,000 cases. Chicago has over 400,000 cases. South Florida has 550,000 cases. And the Metropolitan Triangle in Texas has more than 1 million. Major urban areas have certainly been hit the hardest, and this is expected. For any pandemic throughout history, densely populated areas are the most likely to acquire the virus. And you can kind of see that on the graph here. As you move west of the Mississippi, you start to see more rural areas, more rural populations, and things are more sparse. However, if you look for focus cities, like if you go to Montana, Bozeman, Montana is a larger city there. there's absolutely a large spike. Boise, Idaho, large spike. Salt Lake City, Utah, large spike. I mean, there's rural areas where individuals just cannot live, but where there are cities, there are spikes. I'm south of Denver. We absolutely have a spike in Denver. So city centers are definitely where the greatest number are going to be, but any populated area, neighborhood, things like that, you will see spikes. So what has public health learned? In March 2020, we were still trying to figure out the virus, how it was spread, what it was composed of, things like that. And at the time, the concern was that it was spread as easily through the air as it could be through casual contact. Today, we know that respiratory droplets are absolutely the way it's spread, and we're far less concerned, I guess you would say, with casual contact with inanimate objects. It's far less likely you'll get an infection. So going to a grocery store, if you remain vigilant, you purchase your groceries, whatever it may be, and then you use hand sanitizer when you're done, you're likely going to be very safe. The issues that we're seeing where individuals have that common contact with an inanimate object and become infected are when they're starting to touch a lot of things that have been coughed on or touched by someone who's infected, and then they touch their mouth or their eyes. You always want to try and resist touching your face, and that's probably one of the greatest things I've seen public health wise is strong resistance on people to touch their face. It's going down quite a bit, so that's a positive. But respiratory droplets are absolutely the most common way, and if you use hand sanitizer and practice good health practices, touching inanimate objects, going grocery shopping, things like that, are less likely to cause you to become infected from touching it. You're more likely to encounter the virus in the air by just walking around other patrons in the grocery store. We've also learned that source outbreaks from those who believe the virus is not serious or is an inconvenience have caused serious infection outbreaks and a large amount of unneeded loss of life. Sturgis, the motorcycle rally in South Dakota, was absolutely an epicenter event, very, very large surge event. You had a huge number of people coming together. They didn't stay together for very long. They exchanged virus, and then they all went back to their various states. And I have no doubt that we'll see a similar spike with the terrorist attack that occurred on the Capitol. You had hundreds of people coming together, none of them wearing masks. They went in, they did what they did, and now they're going to, scatter back to wherever it is that they came from. And those are going to cause additional viruses. As a positive, while the infection rates or morbidity rates, as we call them, remain extremely high and are growing rapidly, we are not seeing the same rate of growth in mortality or death. That's a significant positive. That means that our treatments are becoming more refined and that the virus has not increased in its mortality rate. So in that sense, it's a very big positive. The virus is still highly infectious, but it is able to be treated. And if we can get the overall numbers to come down, then those who do have it have a much higher likelihood of having a successful recovery and survival. However, as we're now seeing in Southern California, which I know so many of my colleagues with UAGC live, there's only so many healthcare resources. So if you're looking at over 1 million cases in Southern California, you've run out of beds, you've run out of oxygen tanks, you've run out of excuse me, I'm trying to think of the word, not intubation, but you've run out of the resources, the hospital resources that are needed to help individuals recover. So triage care is going to be upon us. And that's what we're going to start seeing in Southern California, where hospitalization rates increase and the constant amount of resources remain finite. It will exceed the carrying capacity of that facility. And they will bring in specialists who will basically pick and choose, okay, you've got 2 individuals coming in, this person's more likely to survive than this person is. We need to give this person the care. We as individuals and humans would never want to leave that type of decision to anyone else other than us. So that's where, again, at the opening, I say that you have the power to have an impact on this. Staying at home when you can, wearing a mask anytime you leave your house, all those things have a hugely positive impact. What we've also learned is that a dual layer fabric mask or pleated surgical mask is still seen as the best protection. You may see individuals recommend N95 or N99 masks. You do not need those for your daily life. Those are needed for healthcare professionals that are dealing with individuals who have known COVID infections and are highly contagious. You will not interact with that on your daily life unless you are caring for someone who is sick or you yourself are immunocompromised and you are around other individuals who are sick. So if you're in like a long-term care facility. What's been amazing is that we received these masks from HR. These are our University of Arizona global masks, and these are dual layer fabric masks. So this first layer of the mask is what catches anything that's sort of exterior in your environment. And the second interior layer here catches any droplets that you have. The combination of the two prevent that exchange. So these are outstanding masks. You can wash these. I wash mine in cold water with my regular laundry, and they're very, very, very successful. So yeah, I encourage you to go with the dual layer fabric mask if you can. With masks in mind, multiple studies have demonstrated that gaiters or bandanas are not only ineffective, but in the case of gaiters, they can actually increase your likelihood of spreading the virus and acquiring it. For those not familiar, a gaiter is on the lower left, that image there, and it's basically a thin piece of fabric that an individual can pull up over their face. And these are preferred because it's very easy to breathe. It's very easy to breathe because there's basically no substance between you and the outside environment. I mean, it's very, very thin, sheer cloth. The reason it causes problems is that your respiratory droplets are hitting this thin fabric and creating kind of a moisture layer. So if you cough or anything like that, anything that's been caught in that moisture layer in front of your mouth gets expelled just like it would if the gaiter wasn't there. Conversely, on the outside, if you walk into an area where someone does have coronavirus and they've put those droplets into the air, you have a moisture barrier right in front of your mouth. And if those respiratory droplets are going to adhere to that moisture, and then as you inhale, it's going to be more easy for you to acquire the virus. So absolutely, I would recommend staying away from gaiters and bandanas and anything else like that. They're just highly ineffective, and in some cases, like the gaiter, almost more dangerous. And what I want to, I guess, finally, not really a concern for most Americans, but with my wife being a forensic pathologist and conducting autopsies all throughout Colorado, and I know many of my colleagues in the Department of Health Sciences are nurses, we can say with confidence that no individuals have acquired COVID-19 from deceased individuals. So those who are working in healthcare, or in my wife's case, working with deceased individuals to try and figure out their cause and manner of death, we're not seeing the virus pass on that way, which is a huge positive and a large relief for everyone. But again, not relevant for most Americans, but for those working in healthcare, it's welcome news. Moving on, I guess, from what we've learned, I guess, with those slides, is that the U.S. response to COVID-19 has been an unmitigated disaster. I tried to come up with synonyms. I looked for everything I possibly could, and nothing really captured the level of failure that I've seen, not only at the state but federal level, in terms of trying to help prevent this virus from happening. The spread has been mostly unmitigated, and by December 31st, 2020, so not too long ago, we were supposed to have 20 million vaccines and 20 million of those vaccines administered. The actual number for December 31st was 15 million vaccines were available and 3 million had been given. Through a series of systematic failures paired with poor planning and reduced funding for all public health offices across the country, the United States and its population just are not right now in a position to effectively eliminate this virus without uniform laws and potentially some very severe consequences for breaking those laws. So looking into areas where we've made mistakes, the United States accounts for 33% of all new COVID cases worldwide, but we only account for 4% of the world's population. We also account for nearly 20% of the deaths from coronavirus. Again, we're only 4% of the world's population. So we are more than double carrying our burden, almost 4 times carrying our burden for the world. And while we are the primary manufacturing site for the approved vaccines, Pfizer and Moderna, we've only been successful in around administering about 30% of those vaccines that are available. Adding to this failure is the lack of uniform governance. Texas, Florida, and California remain the states with the highest rates of infection. Texas has very sporadic mask enforcement. There is a state law that in Texas you must wear a mask, but you have county commissioners, you have sheriffs saying, well, I'm not going to enforce it. You open your bar up, you open your restaurant up, whatever it is, no problem, because they don't believe it's severe. Florida has absolutely no mask law or mask requirement. That is baffling to me. That is one of the more densely populated states we have in the country. And again, no mask law whatsoever. So this lack of uniform governance and uniform effort that we're all trying to apply gets basically destroyed by, select groups picking and choosing what they feel is the best for them or the best for their state. And then they're able to be free and travel and things like that. They travel, they bring the virus to different areas where it wasn't before, and it explodes. One of the largest causes, I think, for the recent surge has been the growing number of US citizens that are experiencing pandemic fatigue and choosing to travel or attend gatherings for holidays, whatever it may be, birthdays, or not believing that the virus is serious. It's been around for so long. How bad could it be? I haven't gotten it yet. How bad could it be? And then I've had individuals here in Colorado. Colorado does have a uniform mask law, so I will go up to them and say, please put your mask on. I've had some that have been cordial. I've had some that have been hostile, and I've had a few that have actually even tried to cough on me. That type of separation between basic humanity and understanding that there is something happening and you're impeding my personal freedoms is very foreign concept to me. I can't comprehend it with my training or my upbringing. So, but yeah, my greatest, plea to you all is to continue to wear your mask, social distance, and stay home when you can. I know it impacts your daily routine. I know masks aren't comfortable. No one likes wearing them, but they are absolutely needed. The COVID variant, you've probably seen this in the news. It was initially found in the United Kingdom and South Africa, and these new variants of COVID-19 have begun to spread worldwide and are showing infection rates 70% higher than those of the original virus. So if you look on that graph on the lower right, Great Britain started to get the vaccines in December, and then you can see this huge spike. The vaccine had nothing to do with it. I see some questions in the chat I'll address, but the vaccines that are out now actually don't even contain the virus, so they're not infected. These are new infections that are coming from this variant. The primary public health concern for us is that these new variants, not that they exist, viruses are always changing and mutating. It's that these two variants appear to have mutated to make infecting humans that much more efficient. How this came about, we don't know. We'll still investigate. If I had to speculate, I'm guessing it's asymptomatic individuals passing a virus from one to the other, and the virus just becoming that much more efficient each time. But the virus does exist, and it's been identified in 5 states, this new variant, California, Colorado, Georgia, Florida, and New York. This could be one of the reasons why we're seeing such a large spike in California, especially Southern California, is this new variant. Areas under current study for this new variant are, does this new variant, does it exist or impact detection in any way? Thankfully, it does not. Does it impact the vaccines that have been produced? Thankfully, to this point, it does not. Pfizer and Moderna have both come out saying that their vaccines are still effective against this new variant. They can't claim the 95% effectiveness because they haven't done the testing. But with the small sample sizes they do have, the vaccine has remained effective. But we still need to know about the prevalence. How prevalent are these new strains in the system? Are the symptoms any different? To this point, they are not. So that's a positive, but it is far more infectious. This chart is showing the rates of hospitalization and death of the various age groups. I included this just because in April of 2020, when I did the first presentation, the data was so small that it was really difficult to grasp. And now that we're coming up on a full year with this pandemic, this kind of reiterates what we knew. Groups at the highest risk remain 50 years of age and older, and those at the most risk are 75 years of age and over. So before I move on to the vaccines, what to do if you're feeling ill, first call your primary care physician or provider or a health nurse line and ask them for their advice. Do not just show up to a hospital. The great threat with COVID remains that many young people who acquire the virus are asymptomatic and they spread the virus unknowingly. This is why we have shelter-in-place laws and mask requirements, things like that. You can spread the virus without knowing it. And that's due to the incubation period. You can be exposed to the virus, and then 5 to 7 days later, that's when you'll start to feel symptomatic. That's when you may test positive, things like that. So that's why we need to shelter in place, wear masks, social distance, because there is that lag time. So you'll have individuals that will knowingly come in contact with someone who has COVID, and then they'll immediately go get tested. Well, you may test negative on that first day, that second day, that third day, that fourth day, that fifth, sixth, seventh day. That may be when the antibodies actually start to form and when you test positive. So the incubation period really makes fighting this virus a real challenge, and that's why we just basically want everyone to stay away from the virus by staying at home. And know that a person who does have symptoms, that is when they are most contagious. So if you know someone that does have COVID and they're coughing and going through all the symptoms, that's when they're most contagious. Once infection is suspected, you should self-isolate. That's different than quarantine. Quarantine is staying at home with those that are in your house. Self-isolation is isolation within your house. So I'm in my office now with the door closed. That would be self-isolation. No one's going to be able to come into this space. So if you suspect that you have COVID, self-isolate, call your primary care physician. And the CDC recommends that if you have these severe symptoms, that's when you should go to the hospital. Again, if you're not able to contact your physician will give you kind of a milestone moments on when you should become a concern. But CDC's recommendation to go to the hospital would be if you have difficulty breathing, persistent pain throughout your body, a blue tinge to your lips or face, anything that's showing, a lack of circulation, a fever above 103. These are all paired with that, that positive COVID test. So now on to much brighter news. We have safe and effective vaccines that have been developed and are currently being distributed throughout the United States and the world. That's huge. I knew the day would come. I just didn't know it would come this quickly. And it really does speak to the worldwide effort that went into creating these vaccines. The two currently available and approved vaccines are from Pfizer and Moderna, and these are mRNA vaccines. These are a new type of vaccine to protect against infectious diseases, and they trigger an immune response in a different way. So with the flu, your seasonal flu virus, you're actually being injected with a kind of an inert or dead version of that virus. Your body reacts to it, creates antibodies, and it reduces your likelihood of getting it. With the mRNA vaccines, they're actually teaching your cells how to make a protein or just a piece of a protein to trigger that immune response. So the immune response actually produces antibodies in advance so that you are protected when the real virus tries to enter your body. And one of the easiest methods, I guess, is if you can imagine like this being a cell and this being the virus, this is a normal reaction between your cell and the virus. And with the mRNA, it creates a surface that blocks the virus from being able to attach to the cell, and then naturally it will just work its way out because you won't become infected because your cells aren't being impacted. So with these three vaccines, there are many logistical challenges. I've placed some of those at the bottom of the slide. But for example, Pfizer, they have a shelf life of only 5 days, and it requires shipping at -94 degrees. So that's, dry ice levels. Most facilities in the world do not have that capacity. Fortunately for Moderna and AstraZeneca vaccines, much longer shelf life, don't require extreme temperatures for shipping and storage. Moderna's is available now. It has a 30-day shelf life, needs to be shipped at kind of just below freezing temperatures, so -4. Most home freezers can do that, and most hospitals and facilities have that. So very exciting. And AstraZeneca, that one just needs to be kept refrigerated and can last for 6 months. So Moderna and AstraZeneca, those are the ones that are probably going to be distributed most prolifically throughout the world. What is most exciting for me as a parent and a public health professional is that all three of these options have very high efficacy rates, higher than the flu vaccines even that we get seasonally. What's often misunderstood though is the difference between a cure and a preventative vaccine. When you got your polio shot, that will prevent you from getting polio. You can interact with polio virus, whatever it may be, you will not get it. The COVID vaccine does not work in that way. It works much more similar to the flu, where your likelihood of getting the flu is much lower. And if you do get the flu or COVID with these vaccines, the symptoms will be much less. So with the COVID vaccines, they are preventative. They will not stop you from acquiring the COVID virus indefinitely, but depending upon the vaccine you receive, you should receive a rate of COVID protection between 70 and 90%. And if you do get COVID in that range, the symptoms should be much lower. Going back to that misinformation, one of the most frustrating things for me was when the virus or the vaccines first came out, headline on CNN and Fox News, again, politics not mattering, they both said, nurse who gets COVID vaccine gets COVID next day. It was just staggering. That is completely expected because the vaccine needs to work in 2 stages, a month apart, and you need both in your body for at least 2 weeks for them to be effective. So if you get that first shot, you are still susceptible to COVID, but it hampers and hinders the trust that people have in the vaccines. I can tell you from all the research I've done and all the research from people much smarter than me, these are safe and effective vaccines, and they will work to protect you. If you have any questions about that, please email me and I'll be happy to talk with you. 2 closing notes for this slide I want to impart to you all. If given the option, do not mix brands. If you were given Pfizer at the beginning and a Moderna one comes available, do not take it. You need to stay with the same brand you were given for your first shot to your second shot. There has been no research or studies done to show that mixing these vaccines is safe or has any impact on protection. It could actually make, they could void each other out. So do not mix brands. If you were given Pfizer, Moderna, AstraZeneca, Johnson & Johnson when it comes available, you need to stay with that brand. Finally, the stepping back, I guess I would say, kind of in awe that this is a moonshot moment for America. There are 330 million people in the United States, and to achieve herd immunity, we need about 70% or 230 million people to be vaccinated. We've never done that in the history of mankind. So it's going to take a coordinated effort on the part of all Americans coming together, scientists, the average citizen being protective to achieve this goal. And in that mind, it reminds me of John F. Kennedy's request to, place a man on the moon. That's basically what we're trying to do now, is to vaccinate a huge number of people, the entire population, if we can, so that we can, return to some level of normalcy. But if public safety and our lives weren't on the line, this endeavor would just be, it would be mesmerizing to watch. But we're not in that position just yet. One of the most common questions I get is, when can I get my vaccine? And my response is, it depends on which state and which county you live in. It's not the ideal answer, but it's the honest one. That's, again, going to that misinformation. The honest answer isn't always ideal. And it shouldn't always scare you to death. There's good news, there's bad news. The reason it varies from state to state is because there's a lack of central coordination. The federal government, under this current administration, has passed all the responsibility onto the states, and then certain states have even passed it on to the county level. So you have elected officials that don't have backgrounds in the logistics or public health, and they have no idea how to coordinate these types of events. Understandably, it's never been done before, but it could be done much more efficiently. For example, for those of you who live in Florida or are familiar with it, they're practicing a first come, first serve approach. And the result has been seniors sleeping in their cars, waiting in line, sleeping in lawn chairs outside of hospitals. That absolutely is not effective. One of the greatest success stories we have is West Virginia. As soon as the call came to public health offices in November that a vaccine was coming, West Virginia's public health department worked with stakeholders all throughout the state, every major hospital, all the pharmacies, to develop a logistical plan for distributing the vaccines as they arrived. As a testament to their success, Florida has about a 40% success rate in getting a vaccine vial and getting that vial into someone's arm, where West Virginia has a 70% success rate. So we're all striving to be West Virginia. West Virginia is also starting to move out of phase 1. They've been that successful, they're moving into phase 2. So one of the greatest challenges that lay ahead of us, though, right now is California. Not only is California the most populated state in the US, but it's also battling the largest COVID outbreak in the entire world. Los Angeles, Orange, and San Diego counties have 1.36 million infections right now and have lost 17,000 people. That's the equivalent of the entire country of Canada in just those 3 counties. So Southern California just does not have the manpower available at this time to care for the ill, as well as inoculate those who are eligible for the vaccine. Thankfully, firefighters, dentists, other health professionals with experience are stepping forward. But what we're seeing is that we need federal assistance if every state is going to achieve the success that was found in West Virginia. This is a sample plan of what is in Colorado. So this is our phase 1, phase 2, phase 3. Phases are the common terminology we use for these vaccines. This plan deviates slightly from the CDC recommendations, but as I mentioned previously, every state is up to themselves to decide what they want to do. What adds to some of the problems or confusion is that the CDC continues to make recommendations, and those recommendations need to be then implemented into an existing plan that's already not working that great. So, for example, the CDC announced yesterday everyone over 65 should be part of phase 1. They're having trouble getting to the primary healthcare workers where they know where they're at. So adding everyone who's over 65 as well just makes it that much more challenging. The positive is that the vaccines do exist. They are absolutely safe and they are very, very effective. So the next question is, what do you do once you receive that vaccine? The answer is continue to do exactly what you've been doing. Wear your mask, socially distance, avoid travel wherever possible. Don't hang out with anyone that's not in your home without a mask on. The first vaccine is just the first step, and you still can acquire COVID and you still can get very, very severe symptoms. You need both vaccines in your body for approximately 2 weeks to achieve that level of protection that they're advertising, that 90 to 95%. But what's exciting is that once the majority of residents in a state or area have received both vaccines, you will start to see a sense of normal return. People returning to offices, masks being recommended instead of required. West Virginia probably will be at the forefront of this. And if we stay the course and remain vigilant, we can have a normal 2022. 2021 has a chance in Q4, kind of that October, November, December range for the holidays, if everyone again remains vigilant. But we need all the states to participate, not just picking and choosing which states want to participate. And as a note for fellow parents, some states have placed a priority on vaccinating teachers and children aged K through 12 to get them back into the classroom as safely as possible. So if you want to know this information, go to your state health department website. They will list out the phases and they will tell you kind of what's needed. I sincerely hope after this presentation, you're not thinking to yourself that hope is lost. I can confidently say that hope should not be lost. We have achieved many positive milestones, the most incredible of which is that the vaccines do exist and they are very effective and they are very safe. While this virus has impacted some individuals far more than others, and my deepest sympathies go to those who have been impacted or lost loved ones, the fact that we have 3 very effective vaccines mean that we will be successful in the long term. We just all have to work together. So I'll close with the same message I did in April. When all of mankind is impacted by a uniform kind of effort, we have yet to find a virus that we cannot effectively manage. Our world will be forever changed due to this virus, but we must all strive to make that change a positive one. So with the time remaining, and I'm happy to stay after, I'm happy to answer any questions you all may have.
Hi, Charles. Thank you for that. I don't know if Dr. Swenson wanted to come on and ask a question, but I have some questions on the Q&A we can
Okay.
ask if you'd like.
I'll leave the questions to others. I just wanted to thank Charles for a really terrific presentation. I thought I knew a lot about this. You really showed me that I didn't know as much as I thought. So thank you.
Oh,
It's
thank you.
it's a great presentation.
Okay, Charles, I'm just going to read them to you. I'm not attaching names to these, but I'm just to read them as we come along. It says, if one person has the vaccine and others in the home do not, confirming that does not put the others at risk because the person that's immunized has the virus.
That is, it's a great question, and that's not the case. As I mentioned with the mRNA vaccines, that is not, you are not being injected with an inert version of the virus. It's not like a pneumonia virus, a vaccine, or flu virus. It's an actual change. And right now, mRNA vaccines are the only ones that are approved. AstraZeneca's does operate on like a normal flu vaccine, but even in that case, you will not get COVID from someone having a vaccine, I can assure you.
Okay, thank you. And please feel free to ask any follow-up questions if you'd like. I'll go to the next question. Do you think school attendance is an issue? What is the biggest issue? I live in Washington State where they are beginning to send 7 to 12 grade, I guess that's the grades, back to school this month.
Is that a concern for me? Yes, I would say it's a concern because as I showed on that one chart, any individuals under the age of 25 have a very low likelihood of actually being symptomatic. So you will have cluster spreads. Now, we have had schools in Colorado do something similar where they're spacing desks out and they're alternating days for, requiring masks, putting shields up around the desks, things like that. That can be very, very helpful. But yeah, I do have concerns that many states and many schools are trying to return too quickly.
Okay, thank you for that, Charles. Next question. Great presentation, Charles. My question is, there has been no talk of eye protection as far as the virus with the CDC or health professionals during this raging pandemic. Can the virus get through the eyes without any eye protection or safety glasses? Or is wearing a mask sufficient for safety?
Great question. I would say if it were me, if I were traveling, if I had to travel, and again, I strongly recommend against it. If I had to be on an airplane, I would absolutely have eye protection on because you're in an area that is very densely populated and particulates, even with masks on, are going to be in the air. In day-to-day life, I don't think you need it. If you feel immunocompromised or whatever it may be, my parents neither one of them are immunocompromised, but they're both over the age of 65. They feel very comfortable wearing, safety goggles and a mask. You do whatever it is that makes you feel the best. But from a safety perspective, especially in the general and what should be quick interactions that we would have in picking out groceries or things like that, I don't believe you need eye protection if everyone around you is wearing a mask. If you're not confident everyone's wearing a mask, then I'd say load up, wear glasses, wear a mask, do everything you can.
Okay, thank you. Charles, can you repeat the name of the proper mask we're supposed to have so we can look into purchasing the correct one? Thank you.
Absolutely. So we have these dual layer fabric masks. That's what they're called, dual layer fabric masks. They're provided by HR, and you should be able to pull it apart. So if you can see here, this is my mask. That's the front, and this is the back. And you should be able to separate it. This is that front layer that's going to catch what's in the environment around you. And this is the back layer that's going to catch my respiratory droplets. The two can touch, but they're not going to interact in such a way that it's going to allow the passage of things out or in any type of significant manner. That's where the gaiters fail, is that it's just one piece of fabric and it's a thin piece of fabric at that. But yeah, dual layer fabric masks. These are great.
Okay. Thank you for those masks that we received.
Oh, yeah.
What is the value of wearing a mask after having recovered from the virus?
The value of wearing a mask is that you can still acquire the virus again. There are individuals that have acquired COVID after being infected with COVID. In addition, as I talked about, individuals who have recovered and were symptomatic, they're still having fever spikes. They're still having their body react to this hyperimmunity that indicates that there may still be some virus that's in the body. So wearing a mask is, after you've been infected with COVID, is an absolute necessity because you're protecting not only those around you, but you're also protecting yourself from, potentially getting infected a second time.
Okay.
Because if your immunity levels aren't high enough after that first infection, yeah, you can absolutely get the virus again.
Okay, thank you. Will the increase of vaccinated individuals then increase the number of asymptomatic carriers?
Yes, in the same sense that the number of vaccinated individuals with the influenza can carry influenza but not transmit it on. So once we achieve herd immunity at that 70% level, if you get COVID, which your body, again, if you're believing these effectiveness rates of 70 and 95%, which appear very accurate, the virus should not be able to take hold of you. But if you do get the virus, you could theoretically pass it on to someone else, but your symptoms would be so low, and the person next to you who also had the vaccine would be so low, it'd be like passing on the common cold. So it could happen, but not nearly at any severity that I would be concerned with.
Okay, so then this one says, I live in Florida where there is not a mandatory mask policy,
Yes.
and where there is a large population of elderly.
Yes.
Could you speak about the efficacy of the clear plastic shield mask that my neighbors believe are protecting them, and they are advertised where you can flip them up to eat easily when dining out?
The clear plastic masks are highly ineffective unless you have a mask on underneath it. That really is just a face shield. You'll see physicians and other people wearing them, and that's kind of how they became popular, is because when physicians are operating on someone who's coughing or may get bodily fluid, you want it to hit the shield, but they're still wearing a mask underneath. Those face shields allow for air to easily pass all throughout the mask. So yeah, face shield is should give you no comfort in terms of protection from coronavirus.
Okay. Next question. There is a recent research suggesting that people are more lax on the other measures of prevention, such as hand washing and social distancing when wearing masks. Anecdotally, I have noticed people tend to keep their distance from those who are unmasked, but are much closer when masked,
Yes.
in part to hear each other, but perhaps also because they trust the mask more than they ought to. Can you speak to this?
Yes, I have noticed that as well. And it's just a part of human nature that people become more comfortable with seeing something that is more common or in line with their thought process. So I wear a mask and I'll feel more comfortable if I see people wearing a mask. And I will definitely avoid someone I see not wearing a mask because I have no idea what they're expelling and I'm not wearing eye protection. So if they put a respiratory droplet into the air, I don't want to be near it. But yeah, the mask has given some people a false sense of comfort. And that's where I reiterated multiple times, remain vigilant. You know, if I go to the grocery store to pick up food for my family, I'm confident I can pick up canned goods, produce, whatever it may be. But as soon as I get to the car, it's hand sanitizer. As soon as I get home, I'm actually washing my hands properly. Those are things that we must continue to do. The mask alone is a great barrier, but it alone by itself will not stop this. You need social distancing, hand hygiene, all those things.
Thank you for that, Charles. Is it necessary to take a test if you feel you have mild symptoms and are able to quarantine or self-isolate for 14 days? If so, why?
No, it is not. If you are able to quarantine or self-isolate for 14 days and you feel you have some mild symptoms and you don't even need to contact your primary care physician because your symptoms are so low, you do not need to test. Later on, if you're planning to interact with individuals, you probably would want to do an antibody test at that point, just to make sure that, you know, if you did have COVID, that you're aware of it. And then obviously, you absolutely, as was brought up earlier, still continue to wear a mask, social distance, all those things, even though you may have been infected. But yeah, if you're able to stay at home, quarantine, self-isolate, all those things for 14 days, in 14 days, I mean, if you're able to test yourself, we're coming up with some new at-home tests. They're not quite out yet. But if you're able to test yourself, then the quarantine doesn't even need to last the full 14 days. It's like 7 to 10 days now, I think, after a negative test. So, but yeah, you can stay home and you don't need to test yourself then.
Okay. Who can we contact to find out when we are eligible for the vaccine?
The honest answer is I don't know. Every state is different. The same way that every state gets to pick and choose who gets the vaccine, every state is doing it differently. I know here in Colorado, hospitals are contacting the physicians, and then the physicians are contacting those that are in their group. So like my family and I go to the same primary care physician, so they would be contacting my wife and I when we're eligible. My daughter's pediatrician will contact her when she's eligible. And whether they use it by email, phone, portal, it varies from state to state. It is a big mess. But yeah, I wish I could give you a better answer, but I don't know who's going to be contacting you or how. But it will become more uniform in the new administration, because I've seen that plan, and that plan is very specific in saying the hospital will contact you by this method, and it's for the entire country. So once we get to a uniform plan, then that should be made very clear to you.
Thank you for that. Next question. I've heard that more people react to the second vaccine and the Pfizer one is more intense than the Moderna. Is there evidence of this? Also, if I had a reaction to a flu vaccine, not extreme, just flu symptoms, etc., should I assume the same issue to emerge with COVID vaccine?
It's a great question, and it depends. Like most things, these are mRNA vaccines. They've never been done before. So the side effects for them vary from person to person. Some people will have a very intense day where they feel like they actually have COVID. They'll have a fever, they'll have sweats, they'll have pain, they'll have aches, they'll have coughing, things like that, and it will subside very quickly. the live virus, like you're talking about with the flu vaccine that you received and you felt sick, that is different. That is more in line with the AstraZeneca one. But because you've shown that sensitivity, I would say that you are more likely to have some of the, they're not really side effects, but they're expected happenings of having a vaccine. But I can promise you the benefit of having the COVID vaccine far outweighs the potential side effects you would have from the inoculation.
Okay. Along those same lines, if you have the antibody, should you still get vaccinated?
Yes, absolutely. The antibodies you have may have been for a particular strain, and the vaccines that have been developed are to encompass all of the strains that they were aware of at the time. And as I mentioned, Pfizer and Moderna have both said that this new variant, the one that's really, really infectious, is still being effectively treated by their vaccines. So while you have antibodies because you've been infected with COVID, you absolutely should still get the vaccine. It's the same as if you got the flu last year, you absolutely should still get the flu vaccine next year. Oh, you're on mute.
Oh, got it. Got it. Charles, do you recommend changing clothes after being out of the house right when you come home?
No, I do not. I think that goes back to that kind of general contact. If you're around individuals who are not wearing masks, that's a reasonable thing to do and be concerned with. I do recommend washing your mask regularly. I mean, that's where most of the forced air of inhale and exhale is going to happen. On your clothes, it's more casual contact. And again, as long as you're conscientious that you're not touching your face and touching your eyes a lot, the likelihood of you getting coronavirus from your clothes is extremely low.
Okay. Thank you. Are the tests to determine if someone had COVID-19 in the past very accurate?
Yes, they are. The tests vary. I mean, you have the rapid test, which is one where you can get results in about 15 minutes. That one has, I think it's accurate to about 80%, 80 to 85%. It's getting better because that's the one that everyone strives for, is that rapid test. Everybody wants it quick. The PCR test, the one where they stab you in the brain, that one is very, very accurate, but it takes a while. It has to actually go through some PCR testing, and it takes a day or two, but it's 100% accurate. So the tests are very accurate. The antibody test, it's improving in accuracy as well. The PCR is still the standard, but the rapid tests and the antibody tests are getting much, much better.
Okay. Charles, would you like to take a drink of water or something while I get the next question?
Oh, I've got it here. I'm good.
Okay, you're good. Okay, I was worried about that. I think the one I have here is, if you have the antibody, should you still get vaccinated?
Yes, as we mentioned before, the antibodies you have are to that particular strain, and
Okay.
the vaccine encompasses all of the strains that we're aware of at this time. So
Okay.
absolutely get vaccinated. Very similar to, if you had the flu last year, you still need to get the flu vaccine that year if you can, and later on, obviously.
Okay, we're coming close to a little bit over time, but we have a few more questions and then we can end it there.
Okay.
But is the vaccine necessary to produce herd immunity among those who have antibodies, and why?
Absolutely. For the same reason that the individual who had COVID should get the vaccine again, when you get the COVID vaccine, you're getting a constellation of antibodies to be produced that will allow you to fight off various strains of coronavirus, new strains that are coming out. Obviously, the anticipation is that we're going to need coronavirus or COVID vaccines similar to seasonal flu vaccines, like probably once a year, once we really get a handle on it. But you absolutely should have the vaccine, even if you believe you have antibodies, because again, the antibodies that you're getting from the vaccine are far more encompassing than the antibodies you created for that one strain you had.
I think you may have answered this next question just now, but I'll just say it to make sure.
Sure.
Is there any indication how often people will need to get vaccinated each year, like the flu?
Right now, the estimations are every other year, but it just depends on how quickly the virus mutates and how many different variations we have. It could be, every year, every 2 years, every 3 years. We're still studying it because, these vaccines are very new.
There's actually just the last two.
Sure.
I get meningitis with the flu shot. 2 shots, 2 hospitalizations because of the flu shot.
Cool.
Is this vaccine still the best option for me?
That is something you want to talk about with your physician. You've had some very severe reactions to it. I don't know if it's a decrease in immunity that's caused you to get meningitis. Meningitis and influenza are very different. But if it's caused your body to react in such a way that your immune system has allowed this to happen, you'd absolutely want to talk to your physician and kind of weigh the pros and cons of, is the risk worth the reward? I know for like pregnant women, many of them are avoiding the vaccine. That's perfectly fine because there have been very, very limited number of tests. Most of the study groups didn't even include pregnant women. So if you're pregnant or planning to become pregnant in the very immediate future, definitely talk with your physician about whether or not you should be vaccinated. But for everyone else that's not immunocompromised or having that type of severe reaction to a flu vaccine, I would definitely get the vaccine. It's very safe and effective.
Okay, and last question, is there anything specific you can do at home to increase your immunity and ability to fight COVID-19 if you contract it?
I wish Ming Zin was here.
Yeah, that's
It's
amazing.
not really my area of expertise. From a nutritional standpoint, I can say vitamin C is a big one. So, I'm a big fan of the, vitamin water and things like that, but orange juice has tons of vitamin C, things like that you can do. I know for our daughter, because my wife is an essential employee and I can't work with a 2-year-old running around just by myself. We give her a lot of blueberries, blackberries, things like that have a lot of antioxidants. And those things definitely increase your immunity to various viruses. Whether or not it's as effective against COVID is, not determined, but those are general immunity boosting activities in addition to exercise, healthy, balanced diet, vegetables, fruits, things like that.
Excellent. Well, I think that is our last question, Charles. We can't thank each of you enough for being here. And thank you so much, Charles. That was just, that was great. It really was. It was for me. And I think I can be sure that others feel the same way. So we're as Iris mentioned, we're proud to call you colleague. The Department of Health Sciences is lucky to have you. And please feel free to ask any questions, send Charles questions. I think you would be okay with that, Charles, would you not?
Absolutely, yeah. Please feel welcome. If things pop up, email me. I'm happy to help you all. We're all part of the same family, so I'm here for you.
Much appreciated. Y'all stay safe out there. Get your double mask. Buy a couple more UAGC masks, and stay safe and take care of yourself and take care of your family. And we look forward to further presentations as we've seen today. Thanks again, Dr. Holmes.
Thank you all very much, and be safe, be well.
Thank you.